Excuse me, ladies and gentlemen. Thank you for your patience in holding. We now have your presenters in conference. Please be aware each of your lines is in a listen-only mode. You may submit your questions electronically at any time using the chat pod located to the left of your webinar platform. You may also download a copy of today's slides using the Files pod located directly below the slide presentation. It is now my pleasure to introduce our first presenter, Chris Hunt. Please go ahead.
Thanks, Stephanie. Hi, everybody. This is Chris Hunt. Welcome to the May 2019 monthly AHA team training webinar. The topic of today's webinar is building a culture of respect to improve patient safety, medical team performance, and patient and staff satisfaction. And like I said, my name is Chris Hunt. I direct the American Hospital Association's team training program, and I'm a director here as well at the Center for Health Innovation here at the AHA. So thanks for joining us. Seems like we've got people from all over the world as normal, so thanks for all joining in. Just a few rules to go over here to make the experience good for you as attendees. The audio for this webinar can be accessed in two separate ways. You can listen through your phone, and if you do listen through your phone, you're going to want to make sure to mute your computer speakers, because otherwise you'll get really weird feedback and it'll be very echoey. Or you could listen through your computer. Either way is fine. We know that sometimes people's internet connection might be a little spotty, and those people we encourage to listen through their phone. We're going to do a question and answer session at the end of the presentation. The way we like to do this is please chat your questions right into that chat box that you see on the right-hand side of your screen. When you chat them in, we'll try to answer them as you go. If they seem like questions that are really, really good for the whole group to hear the answer of, we'll collect them and we'll do a Q&A at the end of the presentation to try to get through some of them. So that's how we try to do this. So make sure to keep chatting in your questions if you have anything that you want to know about as we go through the presentation. There are also going to be some polls during this presentation, so make sure to participate in those because they'll help color the content of the presentation as we go. Just one major announcement really, and that's the AHA Team Training Program's big national conference is coming up in June in San Antonio, Texas. So we've got some pre-conference workshops that could be interesting to you. One of them is the first time we're offering something called Team Steps Next Steps. And this is a day-and-a-half course that helps take you from being a Team Steps master trainer or somebody just interested in Team Steps to being what we're liking to call a Team Steps influencer. So you're somebody in your health system that's really able to amplify the successes you've had and learn how to really tackle challenges that you've had using the ideas of Team Steps and other team training disciplines. If you want to become a Team Steps Master Trainer, we've got a pre-conference course on that too, on the 11th and 12th before the conference actually kicks off. And on the morning of the 12th, we have 3 different pre-conference shorter sessions that are all really interesting. One's about driving change, one's about resiliency and using resiliency to cultivate change because you need to have that resiliency in place before you can make any difference. And then the last one is about fun activities to help you become just a more entertaining teaching environment when you're trying to get others to understand Team Steps. So to learn more about those pre-conference workshops or to register for the conference as a whole, you can use that link right there. We also have a conference brochure that was just launched 2 days ago, and so that is up on the website as well. So you can see what all the presentations are going to be, see a little bit more in depth about who your speakers are, and it will really, really help you hopefully see the value of the conference and what you might want to attend when you're here, or there, I guess, in San Antonio. We're lucky actually to have conference presenters here with us presenting today, so this is a nice little sneak peek as to something that will be happening at the conference and the kind of really interesting ideas that people will be bringing out while on site. If there's any questions for us, our website is up there, and you can get in touch with us through our website. You can also send us an email. We try to get back to you as quick as possible, and we have a phone number too. So these are questions you have about the AHA team training program or just about the content itself. We're always happy to answer questions or to connect you into the right type of clinical person that can answer what you're looking for. So feel free to get in touch with us. All right, without any further ado, I'm happy to introduce today's two presenters. We have Dr. Bettina Siewert, who is the Vice Chair for Quality and Safety in Radiology, and also Suzanne Swedeen, who's the Quality Improvement Specialist in Radiology. They are both from the Harvard Medical School and Beth Israel Deaconess Medical Center. So we're really excited to have them here with us today. We're looking forward to hearing from them, and I'm excited to hear what both of you have to say. So Dr. Siewert, tossing it over to you.
Thank you very much, Chris, for the kind introduction, and thank you for the opportunity to present our work here today. So the presentation will have 5 different parts. There will be an introduction on disrespect in the work environment, and then a section on the impact of disrespect in healthcare. We will look to understand disrespectful and respectful behaviors that we are encountering. And the largest part will focus on how we can build a culture of respect in our work environments. We will talk about some key behaviors that we would like to foster. We will make some suggestions for leadership because leadership behavior has a big impact on respect in the work environment. And we also will make some suggestions for further action items that we could consider to develop that culture further. And lastly, we'll speak about advantages of a culture of respect in healthcare. Let's first start with a polling question. So this is a question for you. Have you either experienced or witnessed disrespect in the last week? You can answer yes or no, and I'll wait for a little while to have you all participate. I think we're ready for the results. Okay, I see the results are showing. So I can see that 67% have experienced disrespect in the last week, and 32% have not. Thank you very much for that. So when we look at disrespect in the work environment, disrespect is unfortunately on the rise. There is work being done by Christine Porath from Georgetown University, and she has looked at disrespect for many years. And in 1998, she found that 25% of people experience disrespect on a weekly basis in their work environment. And this has increased to about 53% in 2011. And when we look at our own work environment here, we first asked about it in 2015 when we asked about yearly disrespect, and at that point in time, 39% responded yes to that question, and in 2018, it rose up to 67%, which is exactly what you all saw in the polling today. So disrespect is on the rise, and it is something that we need to address. Now, there are a lot of societal reasons for the rise of disrespect. One that in healthcare in particular, I think we're all very familiar with, is that there is an increased workload for all of us. We are all trying to do more work with the same number of people. And what happens in that context, as discussed in this op-ed piece from the New York Times, is that we really, in the end, don't have enough time to be nice at work. We're cutting down on courtesies, on pleasantries that we usually exchange just because we need more time to be efficient and to get all of that work done. In addition, our behaviors and our expectation about behaviors have changed. There is much more awareness about what is acceptable as behavior in the workplace, and we also have more cultural diversity at work, where people from different cultures have other expectations that we need to take into consideration. And a third challenge is that our communication methods have increased over time. And with the increase in social media in particular, there is a decrease in interpersonal skills that we experience. For example, a recent study in high school students found that high school students now mostly communicate with their friends via text message and over social media. About 60% of high school students mentioned that this is their most common way of communication. And this really makes us to unlearn those social skills or to not develop them very well. On the opposite side of this, I think we've also never come to agree in when we use electronic media, email, social media, or even on a phone conversation, what is considered respectful behavior and what would we rather not see people do. We have so far always followed the golden rule, which is to treat others the way that we would like to be treated ourselves. But with the different expectations of behavioral norms, we have to now follow the platinum rule, which means that we want to treat others the way that they would like to be treated. This has its own challenges. First of all, the variability in expectations. We have to become very aware of other people's personal preferences and try to incorporate that in what we're doing in the work culture. There's also oftentimes a difference in perception. And what we need to do here is to establish trust and very open communication around the topic of respect. And for the implementation of a respectful culture, we need to build a common language so that we all understand what we mean when we're talking about disrespectful and respectful behaviors. Now, where do we experience disrespect from? Which group of people affects us to a greater extent? This can come from individuals in a hierarchical setting. It can come from our peers, and then, of course, for us in healthcare, from patients and families. But we could also experience it from other groups, other departments that we are working with, or even from our own institution if there are, let's say, institutional guidelines that we feel disrespected by as a person. Now, in our survey from 2018, it turned out that the most disrespect comes from a hierarchical relationship, so from our attending physician staff or from our managers and supervisors. You'll see another peak here in brown that says technologists. This is merely due to the fact that 50% of our staff are technologists, so this was not different from any other staff group. So the hierarchical relationship is where we are most vulnerable. How about the impact that disrespect has in our work environment? It impacts staff performance. It impacts the outcomes of our patients, our patient safety, staff engagement, and also healthcare costs. Let's first see what we all have seen and experienced in terms of what percentage of staff demonstrate a decrease in performance after they experience disrespect. And your answers can vary from 20% up to 60%. Please take a minute to vote. Okay, I think we are ready for the results. So as we see on the results, the majority felt that 60% of staff demonstrate a decrease in performance after they experience disrespect, and that is correct, although the other answers are also true in some well-defined settings, as we will see. So there were two studies that were done in a simulation study where staff on the way to the simulation training experienced disrespect. And they showed that the performance of an individual is affected in 52 or 43%, depending upon their diagnostic or procedural performance. But what they showed in addition is that the performance of the team was also decreased. And this was because the person who had experienced the disrespect did no longer seek collaborative processes, so was no longer sharing information or sought help of the team members. And overall, the team performance decreased as well. Now, the intervention, the disrespect intervention, so to speak, that was used in this particular study was before the person went to the simulation room, they received a phone call from a person who identified themselves as an international expert, merely to say that they had observed the quality of care in the performance country, and that this type and this level of care would never be acceptable in their own country. How about witness disrespect? So when we do not experience disrespect directly, our performance is also affected. In fact, it is affected in 22% or even 28% looking at creativity. And this was a study that was done in college students solving crossword puzzles and logistic puzzles. And the people who witnessed the disrespectful interaction on the way to the room where the crossword puzzles were being performed, they were affected by this experience as well. And see on the right, willingness to help, also something that decreases when we merely witness disrespect. How about disrespect and patient safety? A survey done in 4,500 healthcare employees revealed that 71% of respondents could tie the experience of disrespect to medical errors, and 21% even to the occurrence of patient's death. And this was not merely from memorizing a single event in that respondent's healthcare career. People very clearly remembered the individual events and could write down the story of the event. So it was felt that this data was very accurately representing the impact of disrespect on safety. And in work at our own institution, we found that disrespect or the fear of disrespect is a frequent barrier to safety event reporting, reported by 53% of staff. Interestingly, in that same survey, only 39% of respondents said that they had witnessed or experienced disrespect. So what this means is that disrespect or the news of disrespect travels. So if somebody experiences disrespect in a work environment, they will talk to people about it, and a much larger group eventually will be affected by the experience of disrespect. And once people have witnessed disrespect in that group, only about 67% will not feel ready to speak up again. So the impact on safety is even greater. Disrespect and patient outcomes. Again, there is a very strong correlation. This is a study looking at data from surgeons at one institution and correlating the data with patients' complaints. So, and these were complaints that were not related to care, so not complaints related to somebody who had a complication. These were only complaints that were related to the surgeon's behavior, disrespectful behavior or disrespectful communication to the patient, either in an outpatient setting or during an inpatient stay. And you can see here that for patients who have a lower perioperative risk, there was no increased risk of developing a wound complication. So the surgeons who were disrespectful and had a lot of patients' complaints did just as well as the respectful group. However, in the group where the perioperative risk of the patient was high, so potentially a more stressful environment for the surgeon to work in, there was an increase in the wound complication rates in those patients. And this confirms, again, the impact of disrespect on team performance. Disrespect and staff engagement. This is a study done in 800 employees in 17 different industries, and this confirms what we are already suspecting. There is a decrease in performance in 66%. People self-reported that. People also self-reported that they just put less effort in that work and that the quality of their work decreased. People also lost time at work, either because they didn't come to work because they were worrying about the incident, or they were trying to avoid the offender. And they spent less time at work, so they would not stay longer after work to finish a particular project, but just leave at the regular time. The commitment to the organization declined. 12% left their job, and 25% were even taking their frustration out on customers, something that in healthcare we very much would like to avoid. And there is a big cost issue with disrespect at work. It is shown that about $6 billion per year are spent on dealing with disrespect in the workplace. In healthcare, a lot of that money is due to malpractice suits, but it is also due to staff leaving and absenteeism, so having to find new staff, retraining new staff, fulfilling those jobs. That all costs extra effort and increases healthcare costs overall. Now I'm passing this over to Suzanne.
Hi, everyone. Thank you for having us. First, before we build a culture of respect, we need to understand and identify respectful and disrespectful behaviors. Disrespect can manifest itself in a variety of ways, including through our verbal language, our own body language, as well as our actions and inactions. In Paul Mashenko's book, The Respect Effect, he cites behaviors such as not listening, not being fully present in the moment as disrespectful. Other examples including texting or talking in the middle of or taking a call in the middle of a conversation, or the use of subtle, condescending language that implies, I know better than you, or not being included either in a decision that affects you or not being included in the sharing of information are considered disrespectful behaviors. On the other hand, respectful behaviors can include giving somebody your undivided attention or time, including others in discussion, seeking someone's opinion, or asking somebody for help, a simple recognition of a job well done, or giving public recognition, or even defending somebody publicly, and showing interest in the person as someone more than just their role are respectful behaviors. So to build a culture of respect, we first needed to create house rules and a common understanding. So by definition, culture is the characteristic features of everyday existence shared by people in a place or a time. So when building a culture, a grassroots movement with participation from the bottom up is needed to understand what are the important characteristic features and to clarify expectations as well as perceptions. So, for example, staff have different expectations of their managers than they do of their peers. So while certain language or phrasing may be acceptable when coming from a peer, that same language is considered disrespectful when coming from leadership. As we work towards building our culture of respect, we set as our foundation a common understanding that respect would be the entry-level characteristic for all workplace interactions. Being treated respectfully is a right of all and not simply because of one's role or status. So to begin our journey on a more respectful culture, we sent out an employee survey to all 648 radiology employees, and we had a greater than a 30% response rate. The survey included 2 free text questions asking respondents to share 3 behaviors or situations that make them feel respected in the workplace, and 3 behaviors or situations that make them feel disrespected in the workplace. From these 2 questions, we identified 612 behaviors. So for our next step, we held a multidisciplinary discussion in order to develop a consensus on what would be our major themes or characteristics for our respectful culture. And we chose acknowledging the individual, actively listening, utilizing a team approach, creating a positive work environment, and expressing appreciation. So to understand the characteristic features of each of our 5 themes, it was important to understand their opposing features. So on the disrespect side, lack of acknowledgement included being ignored, which was identified by 53% of our free text respondents as being disrespectful. Not knowing a person's name after working with them for a period of time, or simply walking by a person in the hall without saying hello, were considered disrespectful behaviors. On the other hand, respectful behaviors that we wanted to foster included knowing the names of the people that we work with, smiling and saying hello. So to accomplish this, our action items included introducing ourselves and any new team member. Our department is very large, and so it's not really realistic to think that we would know everybody's name. So we wiped the slate clean and said that it was okay to ask the person their name if they had forgotten it or if they actually never really knew it. Next, we asked staff to give us a fighting chance to learn their name and to remember it by keeping their ID badge front-facing so others can read their name. Something that has been helpful in our procedure areas has been having a whiteboard listing today's team members, including the transporter's name. For our greeting, we're utilizing the 10-5 rule, which says that when you come within 10 feet of a person, you give some sort of acknowledgement, such as a nod or a smile, and say hello to the person when we get within 5 feet of them. Leaders who know something personal about their staff beyond their role was considered to be respectful. Active listening was our second theme. On the disrespect side, disrespectful listening can occur in a number of ways. Over 2/3 of our respondents considered not listening to their suggestions or being unwilling to discuss concerns to be disrespectful, not asking or valuing someone's opinion, particularly if it affects them or the work that they do, not correcting an identified issue, or not being responsive to emails and voicemail leads staff to feel that they have not been heard. So it sounds very straightforward to tell people to listen more, but as you can see from DeVito's model of listening, it's actually rather involved. While hearing is accidental, involuntary, and effortless, listening is focused, intentional, and voluntary. First, the listener needs to receive the message, which can be impacted by noise, either environmental background noise or psychological in the context of increased stress or workload. Next, the listener needs to figure out and understand the meaning of what is being said, to share one another's meaning exactly. And while the inability to share one another's meaning seems inconceivable, in healthcare, it actually happens all the time between different areas, different providers, and different service lines. Remembering is the point where you reconstruct what was said, and every person tries to fit that message into a system they already know, which may not be what was meant at all. Evaluating is where you judge what is being said. Does this make sense? Listeners' own biases and experiences play into this, and each person could evaluate the message differently. Responding is when the listener provides some type of feedback to the speaker, either verbal or nonverbal. In our models for active listening, these barriers can be addressed by giving undivided attention, asking questions for clarification, summarizing what was said, and repeating the information back. Unconscious bias training may be helpful to evaluate biases and prejudices. In Celeste Hadley's 10 Ways to a Better Conversation, she says listening is the most important skill in a conversation. Respectful listening requires the person to be fully present and in the moment with no physical distractions like phones or laptops or mental distractions such as thinking about things other than what is being said in that moment, acknowledging what is said, listening, understanding, asking questions, and summarizing. Staff want to feel that their opinion matters, so validating and valuing others' opinions, especially those that are different from yours, are important. Soliciting diverse and opposing opinions is an important safety measure and allows for a more detailed analysis of an event. You do want to hear what you might be missing. Leaders can take this concept a step further by seeking someone's opinion, especially those closest to the work. So working with a team approach was our third theme, and behaviors such as failing to support either with time, resources, or simply not pitching in when help is needed, even if it's not your job, was considered to be disrespectful. Inequality of team members refers to when different applications of rules or policies are applied to different people, being spoken down to, being treated with a condescending attitude or spoken to using condescending language or tone. Telling people what to do is a very sensitive issue for people and is considered to be highly disrespectful. Asking instead of telling is much more respectful. So respectful team approaches include offering support and help and asking and accepting help, which we found to be tricky. Our group came up with this neutral yet respectful way to ask staff for help. And we say, may I ask you to help me with X? And this we felt was actually very worthwhile to spend a little time on and to develop. Giving and receiving open communication between team members where positive and constructive feedback is provided demonstrates a respectful team approach. Positive feedback lets us know what we should do more of and makes constructive criticism that much easier, or constructive feedback that much easier to accept and integrate. And with constructive feedback, we want to be sure that we're not actually providing negative feedback. Constructive feedback involves evaluation, corrective information, and generally promotes improvement, where negative feedback involves criticism, judgment, and fault-finding, and actually reduces the likelihood of any kind of positive change. So care should be taken to communicate any need of improvement in a way that won't be hurtful or it won't lower the person's self-esteem, because typically that does not improve any kind of long-term performance. So it's all in the delivery here. Respect is also conveyed when people are included in decisions, especially those that affect them or the work that they do. To support their team, the leaders can provide support in a time of need. For teams to be successful, it's important that the team recognize the critical role of other team members. Understanding the role each member plays helps to avoid misunderstandings and incorrect assumptions. Roles can be clarified during interdisciplinary staff meetings and at the start of the day through morning huddles. When building teams, Lencioni highlights 3 important traits that should be focused on during the recruitment stage: being humble, being able to put egos aside in order to work for the greater good of the team, commitment to a job well done and going beyond when required, and having emotional intelligence, having a good sense of people are all traits that should be focused on during time of hiring. Blaming, criticizing, yelling, and impatience creates a negative work environment and not only affects staff satisfaction and retention, it also impacts patient safety. So if we think of the nurse who goes to administer medication to her patient after just being publicly criticized or yelled at, her mind isn't on her patient, her mind isn't on the medication she's about to administer, her mind is back in that negative event, and it's right there in that moment where the patient's safety is impacted. In our work, our foundation for a positive work environment starts with assuming the best of each other. And while this didn't really bubble up much in our survey, it was a big topic in our group discussions. We learned that assuming the best of one another was considered a high-impact behavior. The person on the receiving end who experiences this receives it as being highly respectful. So while on our journey, we learned that people actually do want to treat each other respectfully. So here again, we cleaned the slate and said that going forward, everyone would assume the best of each other and not bring in prior history or prior baggage. Assuming the best fosters a positive attitude and the ability to empathize and promotes a better work environment. For our leaders, defending somebody publicly had a similarly strong respect effect. Chris Argyris' ladder of inference describes the thinking process that we go through, usually without realizing it, to get from a fact to a decision or action. Using 6 rungs on a metaphorical ladder helps us to get to what we see, what we believe, and what we will do about it. If we jump the ladder too quickly or jump around the rungs, we risk bad or misinformed judgments. To avoid climbing the ladder, question your assumptions and conclusions and seek contrary data. And for leaders, gather more information before forming an opinion and making a decision. Appreciation doesn't need to cost money or take a lot of time, but a lack of appreciation can be costly to an institution due to staff dissatisfaction and dwindling retention. Disrespectful behaviors include failing to recognize and appreciate the skill, the effort, or the workload that is required to complete the job, or failing to say a simple thank you, for instance, when somebody takes on extra while covering a coworker for vacation. These can lead the person to feel unappreciated and disrespected. There are multiple ways to show appreciation. Sincere words of appreciation could be either verbal or written, the offer of assistance or help, the opportunity to spend time with your supervisor to discuss things on your mind. And there are also awards and tangible goods that can be given as a sign of appreciation. Here, people may have different preferences, which take us to our next polling question. How would you like to be appreciated? Words of appreciation, verbally or written, assistance and help, meeting time with your supervisor, awards, or tangible goods? You can click as many as you like. I think we're ready to see the results. Oh, wow, words of appreciation. And it's just, so words of appreciation should be genuine, sincere, and leveled appropriately to what has occurred and not a blanket thank you to all. In Aubrey Daniels' Bring Out the Best in People, she writes that verbal appreciation and recognition is the most impactful. Expressions of appreciation should be timed as close to the event as possible and given publicly so others can observe. For our action item, we chose a day of the week. So we have our Thank You Thursday to express appreciation to our staff. Also, appreciation for leaders comes when you recommend someone to others. That is received very highly. So the power of a thank you even trickles down to hand hygiene. Here in Emily Sickbert-Bennett's study, she saw hand hygiene compliance increase by 13% simply by saying thank you. And now I'm going to turn it back to Bettina.
Thank you, Suzanne. Looking at which of those cornerstones of our culture of respect are the most important ones, when we look at the lack of the different cornerstones, the positive work environment stands out the most. So an environment where people are blamed in public, criticized, or people jump to conclusions and make the wrong assumptions. And this is followed by a lack of listening and a lack of a team approach. When we look at the respectful behaviors, what makes people the most appreciated, the most respected is appreciation. And this is followed by active listening and, again, working together as a team. Now that we have built a consensus on what are the behaviors that we understand as respectful and that we would like to see more of in our culture, we have to build these skills together in a consecutive fashion. And then we also, by doing that, we increase trust in our work environment. And we build these skills from the individual. So first we learn to acknowledge the individual and we learn active listening skills. We then learn to work together as a team in a small group. As a larger group in a department, let's say, we will focus on establishing a positive work environment. And only at the end we will, as individuals, learn how to express our appreciation. And while it is tempting, since we saw from the survey that expressing appreciation is what shows or is perceived as respectful the most by staff, it is important that we do this at the end of the process, as we first have to learn all of these other skills, and we have to show to each other that we are serious about being respectful and that we are sincere. And once we have gone through that effort, we're able to show and receive the appreciation. So then for the implementation, this process will be a process that goes from the leadership down to the frontline staff. So as we saw at the beginning, since disrespect is oftentimes experienced in a hierarchical relationship, we would like to train the leadership first, again, to show that everybody is engaged with this process and that we're taking this very seriously in our environment. So our departmental leadership, our physicians, managers, and administrators were part of a dedicated workshop in which those skills were taught. And after that, we started to implement the behaviors for frontline staff. We're rolling this out over several months. Suzanne and I are attending all the staff meetings every month to roll out another behavior, which also gives us a lot of opportunity to get feedback and input on how the process is going. We will also provide other measures to reinforce a culture of respect. We do offer support for individual events. So we can learn about an event either through a departmental email that is available where staff can report a disrespectful interaction. We have open lines of communication with supervisors who may learn about from staff in their work area about disrespectful events. So then we can go and provide one-on-one coaching about one interaction and talk about what the interaction and the disrespectful behavior meant to another person. But of course, we also need to be able to address disruptive behavior. We have a program for professionalism in our department, and it's also helpful to have this on an organizational level, an institute for professionalism that helps to provide support for staff who have issues with disruptive behavior and who require very focused coaching and help. And in addition, we should probably focus on hiring for civility. That is currently only done in 11% of organizations in the U.S., but by simply bringing up civility and teamwork skills in an interview, we can make it very clear to applicants that our organization is very serious about the importance of civility and that this is something that we're looking for. So here's our next polling question. In your institution, when we hire new staff, we specifically ask about civility and teamwork skills. I think we're ready for the broadcasting of the results. Thank you very much. So 53% of you hire specifically for teamwork skills and civility. That's fantastic. Just a brief word on virtual disrespect. Virtual disrespect is an issue that Lydia Ramsey discusses in her book that talks about manners that sell in a business environment, but these are definitely applicable to our environment as well. The two most common disrespectful behaviors that she talks about is phone manners, so people not stating their name when they answer the phone and not saying goodbye is experienced as very disrespectful. And email etiquette is another vulnerability. One is not answering emails. That is a vulnerability particularly for leadership who receive many, many emails a day, over 100 emails per day, I'm sure. And then also the CCing of emails is quite tricky. So not including everybody in emails, on emails that should go out to a large group of changes in policy or work environment or inquiring about which change in work environment would be needed is perceived as disrespectful. Where on the other hand, to include too many on emails that are of a sensitive nature, such as emails about serious reportable events, is also seen as disrespectful. Let's briefly at the end talk about advantages of a culture of respect. So respectful people have some great benefits from treating others respectfully. They are perceived as warm and competent, and because of this perception, they are more often sought out for advice. They are seen as leaders, and because of the improved communication, it makes it easy for other staff to share information with them. Their own performance will be better than their colleagues. And how about our patients? So here's a study that looks at relational coordination and the results in patients who underwent total hip and knee arthroplasty. And in this patient population, the outcomes they were looking at were postoperative pain, postoperative functioning, and length of stay, which are very good outcomes measures. And these hard measures were improved by staff showing a high degree of relational coordination, which includes the degree of mutual respect that is displayed by team members in front of the patient to each other, by an increase in communication and showing the strength of a shared goal, which is the recovery of the patient. So a huge impact on patient outcomes. So in conclusion, creating a culture of respect is essential. It improves patient safety, experience, and outcomes, staff engagement, and healthcare costs. and it requires creating a common understanding and mutual trust. I would like to close with this quote by Mary Montagu, which says, "Civility costs nothing, and it buys everything. Certainly in healthcare it seems that way." We want to thank our RESPECT panelists and our RESPECT committee who have supported this work to a large extent and have made great contributions to it. And also want to thank you for your attention. We welcome your questions and comments. Here are our email addresses and 2 more links that were to the TED Talk and the implicit bias link that we mentioned earlier. Thank you very much.
Thank you so much, both of you. That was really wonderful. We got a lot of great conversation going on in the chat box. I always feel like when there's that many good conversations going on, the presenters are doing great. So thank you so much for your presentation.
Thank you for having us.
You're welcome. All right, so just a couple of questions. Well, there's actually a lot of questions, but we have about 5 minutes. So at the start, you were talking about how we really need to transfer from the golden rule to the platinum rule, to treating others as they want to be treated. So a couple of people asked around that point in the presentation, how do you actually know how people want to be treated? How do you train others to understand not only generational differences, cultural differences, even personal differences? You know, I might be a different Gen Xer than the next Gen Xer that I work with. So how do you go about and do that?
Yeah, so this has come up in a lot of our group discussions as we were going to staff meetings. And it is very important to get a conversation started because, for example, a good example is people using phones in meetings or laptops in meetings. For the people on the older and age spectrum of the workforce, that is seen as very disrespectful, whereas younger people see this as maybe a benefit to the discussion. Maybe they are looking up additional information in a meeting that can bring the discussion forward. So the more we talk about these different perceptions, the more we can develop an understanding and also develop our own rules. We could decide, you know, if more than 50% of the group thinks having a laptop open in a meeting is disrespectful, that we as a group then decide not to do that and to honor their perception of it.
I like that having that conversation with people and really keeping an open mind. That's nice. I'm looking through all of the different questions here. Another question goes around, there's a few questions going around the idea of how are staff encouraged to either confront others when they're seeing disrespect? Are they being asked to, use a certain tool? Somebody here mentioned the idea of the desk script from the Team Steps Toolkit. I know that there's a lot of other ways of approaching this as well, crucial conversations and the like. So what are the exact steps you're having people go through?
So it is very effective if people can address it in the moment. That is, okay. That may not be something that people are comfortable with. So if people are not comfortable, we have avenues for them to report that, which is what we shared during the presentation. Otherwise, if people can find a way to say that this may be perceived as, can you rephrase this, please? This may be perceived as disrespectful. That could work.
Yeah, that sounds good. There were a couple questions, and I know we only have a few minutes, but can we spend the rest of the time maybe returning to the ideas around increased hand hygiene? Somebody had a question along the when you were talking near the graph about the increased adherence to hand hygiene and adding in the simple idea of somebody saying thank you. So can you talk a little bit more about that connection?
Yes. So the way the study was done was to improve the performance was that whenever a coworker saw that the other person was not washing their hands, they were reminding them, please remember to clean your hands. And then the person who was reminded by agreement, needed to say, thank you very much for reminding me. That was the only intervention that was done in the study, so that everybody felt comfortable. This was in particular seen with physician staff, so nursing staff and technical staff felt uncomfortable reminding physician staff to wash their hands before they enter the patient room. And with this intervention, where the physician was instructed to say, thank you for reminding me, they were able to improve the hand hygiene compliance.
That's interesting. That's fascinating to see how just that idea of knowing that somebody is going to give you that thank you back, it takes the worry out of it and the sting out of asking somebody else to do something. It's really,
yes,
really,
exactly.
Yeah. Okay, well, we are at a minute to the top of the hour, so I wanted to take a moment to thank both of you for spending your time to present, and to thank all of the people from around the world that were here online. We really appreciate you calling in, joining in, spending an hour with us in the middle of the day or in the evening if you happen to be somewhere else in the world, or in the morning. You'll be receiving an evaluation shortly in your email that you use to register. So we love it if you could fill that evaluation out. It helps us quite a bit, helps us understand what we can do better and what went well in the spirit of Team Steps. And so thank you all for joining, and remember to check out the AHA Team Training National Conference, especially since you just heard from two of the speakers this month. They'll be there, and I think we'll have quite a nice time in Texas. So thank you all again for joining, and have a good day.
Thank you, ladies and gentlemen. This concludes today's presentation. You may now disconnect.